Greetings. Hello, everyone. Welcome to February season of our WCG network on the WCG Talk Radio. We're the worldwide community empowerment group where we're speaking life into the community. I am Dr. Babs, your physician and founder of Living at Your Finest Wellness, which is a holistic direct primary care practice in Marietta, Georgia. It is truly my honor today to be your show host for this evening segment on the holistic perspective. So we're here to enrich you with information that is inspiring and impactful. So this month of February is World Cancer Awareness Month. And it is a small month, days are running so fast. We're almost done with the month. But I thought it was important to just pause and just acknowledge just all the research that's gone into cancer, and particularly when it comes to prostate cancer. I want us to touch on that because we've had so many deaths, unfortunately, and it's on the rise. So I want us to talk about that. And so my question today, I want you to ask yourself as you're joining, I welcome you to participate in this conversation. The question is, are you up to date with your PSA labs? That's if you're a male. And if you're a female, your loved ones, maybe your brother, your husband, your partner, your friend, are they up to date with their PSA? PSA is the prostate specific antigen, right? So we're going to talk about that today. But I want you to ask yourself that question because we're always busy. We never really pause to ask ourselves these questions. So really ask yourself, if a male is next to you, ask them, have you gotten a PSA? If they're of age, of course, right? So ask that question. So this evening, my goal is to discuss what are the stats, what are the statistics around prostate cancer, what are the risk factors. I'm going to touch on other cancers, but I really want to focus on prostate cancer today. I'm going to talk about what those preventions are, how do we screen, how do we monitor, what's the treatment, and I will end with commonly asked questions. All right, so I would like for you to please tag a friend, share with your neighbors, stay updated, with all our programs, because this program is for you. It's to get you empowered and encouraged. So we are live on all social media, online streams, Twitter, YouTube, Facebook, IG, even the WCG Talk Radio Network. We have some new platforms, the mobile app. You can find us everywhere. So I want you to please just tag your friends and neighbors and let them know we are here to make a meaningful impact. So we appreciate your time and your support in spreading the word of this amazing organization. Two important things before we get started, two quick announcements. I want you to know that the information shared on this talk radio is not intended as medical advice, but instead it's just to provide educational information to support you on your wellness journey. And the views and opinions expressed by myself as the host or other guests doesn't necessarily reflect the views and opinions of the network. All right. I like to always start off with a quote, an inspirational quote. And the one that I have today says, "Time and health are two precious assets that we don't recognize and appreciate until they're depleted." All right. So that is by Dennis Waitley. So very important. Let's just pause. Let me say that again. Time and health are two precious assets that we don't recognize or appreciate until they have been depleted. So we don't want to be depleted today. We don't want to be depleted at all of all our energy and all of our time. So that's why we're here today, to have these conversations. All right. So yeah, so let's get ahead. Let's go ahead and get started. I have a few slides to share as we get started. And I want to start off by talking about what is prostate cancer. So I'm going to share, because I'm a visual person. Let's make sure that I'm able to share. Yes, I am. Very good. All right. So prostate cancer. Let's start with what prostate is. Prostate is a male reproductive organ. All right. So in anyone that identifies as a male, you have a prostate. And as you can see in my diagram, it sits just right beneath the bladder. And its main role is to produce the fluid, the semen, right, for reproduction. So it sits right under the bladder. And really, when cancer occurs, as you can see in the picture on the right, it is where you have abnormal cells reproducing within the prostate gland. As you can see, there's several delicate structures in this area. You have the bladder, and then you have the urethra. The urethra is the pipe that urine comes through to get, to be let out through the penis, right? So that is all the structures that you have around the prostate. The prostate, as you see, is right beneath, and then you have the urethra, as I mentioned. So it's important to point that out so that you know. Now, as I continue, I want to emphasize that prostate cancer, that's when cancer is seen within the prostate gland, it is the number 2 cause of death in male. The first one is lung cancer. The second one is prostate cancer. And unfortunately, it is increasing. The estimate is that for every 100 people that you have, you're going to have quite a bit of them suffering from prostate cancer itself, and 2 to 3 people dying from it. So it's increasing in number, and it's increasing for so many reasons. A few risk factors that I want to emphasize will certainly be age. So the older males are more at risk. African American men are more at risk. Every male is at risk for prostate cancer. But when it comes to older men, African American, and family history, that triples the risk. So those are risk factors to be aware of. The question then will be, how do I know? How do I know I have prostate issues? Well, there are some symptoms, certainly, but I want you to also be aware that some people don't have any symptoms. Doesn't mean that you should avoid screening, right? And I'm going to talk about when we should screen. So some of the symptoms are anything to do with the urinary symptoms. So let me just put that picture up again so that it makes sense. So let me share that picture right again. So you see that this is the bladder, right? So if the prostate gland is either enlarged around the bladder and it's encroaching against the pipe that the urine goes through, you can imagine what's going to happen. It's going to be urinary incontinence, where you go to you're trying to get to the bathroom, but you can't get there quick enough, and you're either peeing on yourself, or even when you go there, because everything is so unstable there, you feel like you've emptied your bladder, and go, and then you come back, you feel like you have to, so you have hesitancy, there's urgency, there's frequency, all those things are going. There's even poor stream. As you can imagine, with this cancerous tumor, you can also have blood in the urine. So there's blood in the urine, there's pain, depending on how big the cancer cell, they can have back pain. So there's a lot of symptoms that tend to come around urination. They could also be just pain or during ejaculation. So there are symptoms that please be attentive. Again, this is for everyone. If you're a woman and you're watching, you have a brother or a spouse, just ask the question, have you done a PSA? Are you having any of these symptoms, right? We don't want to ignore these things anymore, because this is definitely something that can be prevented if we screen early. So those are the symptoms that I've just described. As I mentioned, some people might not have any symptoms, but these are the commonly seen, experienced symptoms that people might talk about. Now, the question then is, how do we screen, right? So how do we screen for prostate cancer? It's through PSA. And what is PSA? That is prostate specific antigen, and that is a protein that is secreted by the prostate gland. So the tricky thing about PSA is that it's always present, right? So some people will say there's no normal range because there's always going to be PSA, and a PSA can actually be increased for several reasons. So maybe as you age, the prostate gets enlarged, right? And then it will secrete more PSA, right? And that was part of the reasons why in 2018, the United States Preventative Service Task Force changed the guidelines and said, don't screen men anymore. Don't screen them. Let them complain of symptoms first before you screen. And the reason was because people were screening, people were getting PSA was high, and then they got a biopsy and it was false positive, and then they had more complications from the biopsy and procedures than the prostate cancer itself. That was in 2018. So the guideline changed. And at the time, I also was doing the same. Unless my patients complained, even my African American male, all I did was I asked, do you have a family history? If they said no family history, they didn't know. Unfortunately, a lot of us don't really know our family history. So that wasn't sufficient. But because of the guideline, if they said there was no family history, then we wouldn't screen them for a PSA because we were afraid of having high levels, and then we'll interpret that as being abnormal, and then, we'll go down the rabbit hole. But with the recent guidelines, with the recent changes that we're seeing, observing, Martin Luther King just lost his son. Late Martin Luther King lost a son young age at 62. There are many, many people, that are coming down with prostate cancer and are dying from it. And again, yes, with prostate cancer, it is slow growing. And the most common type of prostate cancer is what we call the adenocarcinoma, which is the most common, which they are more aggressive. So if a younger person, younger than 50, has prostate cancer, it's more than likely that they would have the aggressive type. And there are several other types of cancer. So depending on which type will kind of determine the prognosis. But back to what I was saying about screening. So now the guideline really is, in your 40s, please get screened. Ask your doctor, have that conversation. Even if your insurance is not going to cover it, please find where you can get prostate blood test. I've always ordered it for my patients, even when I was in the traditional healthcare system. I ordered it, and I had a senior colleague that said, "Well, everybody has nocturia, and what nocturia means just waking up at night to pee." That was a ICD-10, 9, 10, the ICD-9 that we would put, the ICD-10 rather, I meant to say, we would put that just so that it could be covered by insurance. Because again, as you guys know, insurance might not want to cover, so we always have to find a way to justify. But in direct primary care practices, I'm so pleased that our PSAs screening is just $6 to get it checked and at least know what your numbers are. So when you track that over the years, every year you get one, you want to make sure is that between 0 and 4. If you have a big bump one year, it's maybe 3, and then there's a big bump to 10, then you definitely want to have your physician or your provider to do a rectal exam, which we call the digital rectal exam, just to see the size of the prostate. Is it enlarged? Are there abnormalities when you feel? I know it's uncomfortable, but it needs to be done, right? Because it's so important. Our lives are very important. There's so much hope, so much life. So we want to arrest it as quick as possible. So that's the screening. The PSA, which I just mentioned, has a range, but if you see it over a period of time trending and increasing, even if you don't have symptoms, that then needs to be followed up with an examination and possibly a biopsy, depending on what's going on. But you have to have that conversation with your physician and with your provider. Other things that are done is a biopsy. A biopsy is just to try and see, it can be guided with an MRI, just to see where you have some cancer cells. And if you have to do the biopsy, the tumor, you biopsy, and you want to kind of get in a sense of if there's cancer. Now, let me share this picture because this you probably might have heard of. This just gives you a staging for prostate cancer. So it's called the Glanson-Patton scale. And really what this does is if, for instance, there's an increased trend of the PSA numbers, it's supported by a rectal exam that shows an enlarged prostate, or there are symptoms, you do a biopsy, it could be guided with an MRI. These are the things that give the score, right? So how differentiated is it? Is it poorly differentiated, just means so many abnormal cells, or is it just well differentiated? So this is, if you've ever heard anyone talk about the score, this is what they're talking about, score of 1 to 5. So these are the steps that certainly need to be followed, but it has to be in a collaborative understanding with your physician when you get this done. And this, if you were a primary care provider, they would already refer you to a urologist, right? So if they do a PSA and it's high, they do a rectal exam, follow-up would need to be done with a urologist because they're the ones that would do a biopsy, and then they're the ones that would proceed to what the treatment of choice is. So let me pause a little and just say a few words about the reason why there was a slowdown in PSAs being administered. Again, back to the false positives. A lot of people had complications from having biopsies because they're complications. They can be suddenly, especially if there was nothing to worry about in the first place. So things like pain, right, blood in the semen or infection. There's always a risk of infection and other things in terms of treatment. Could it cause erectile dysfunction? Could it end up causing bowel problems just because of all the things that are around that prostate? So those were some of the reasons. But now we've seen that the benefit outweighs the risk of those complications. And that's what we always have to look at to have that well-informed conversation about what your risks are. If there's a family history, if age is an issue, if you're having all those symptoms, the benefit of going down that track outweighs the risk of not, because God forbid it's prostate cancer and then it claims a life. So that's why we always want to check that. All right, so I'm going to move on now to treatment, and then we'll wrap up with commonly asked questions. So what are some of the treatments? You said, okay, yes, Dr. Babs, thank you for giving us all this information. I'm going to make sure that I've been getting a PSA, and if I haven't, I am going to request for one and know what those numbers are. Maybe I've had them before, I don't know what my numbers, they've always told me it's normal. Well, ask your doctor or ask your physician, what has my numbers been over the years? Recently, we had to track my husband's PSAs because he's been getting his, and we needed to just track it and make sure that it's fine. So we've done that quite a bit, and we're glad that we've been keeping an eye on it. Now, when it comes to treatment, what are the treatment options? So I'll share a little bit about the treatment options. So treatment could fall under some categories. One is expectant management. And what does that mean? Expectant management means the PSA is not so high, you're just monitoring it. You can either monitor it actively or you can monitor it watchfully. So just watchful surveillance. And really you're just checking to make sure that nothing is aggressive, it's not increasing much higher. So some people can just get that done. But if you're already on the older age, and it's high, then you really want to do something more than just active management. Now, the other treatment is radiation. Radiation. So to attack that organ, to find out what's going on, the cancer cells within the gland, as I showed you the picture, that could be radiation. And then the other option will be surgery. So to take out that whole gland that sits right under the bladder, to take it out completely. So those are the treatment options. When it comes to radiation, it could be internal or external. So those are some of the treatment options that we have. Now, I want to mention that even though, yes, I've spoken about expectant management, which includes just active watching or just surveillance, just paying attention and just observing symptoms, I want you to understand that lifestyle matters. So you don't want to do it in the absence of lifestyle. So lifestyle is important. I had a patient some years back. So he was diagnosed with prostate cancer. And unfortunately, the oncologist, they did what they needed to do, and he had surgery, but nobody spoke to him about his food, because when it comes to cancer, those are abnormal cells that feed off inflammation. So feeds off sugar, feeds off foods that are just acidic foods. So unfortunately, he wasn't informed about changing his diet. So his diet, unfortunately, was this SAD diet, SAD diet, the standard American diet. So he was just feeding that cancer, even though the cancer was taken out. But later in life, it reoccurred just because, and not in the prostate, of course, because the prostate was taken out, but in other areas. So we want to always make sure that we're eating a balanced, nourishing foods that feed our souls, right? That fills our body and promotes optimal well-being. So certainly nutrition, staying hydrated, cutting back on those sugary drinks, because those drinks, they empty calories and they only make the bad bacteria happy. So nutrition, certainly. Physical activity also matters. Moving, getting that blood pumping, getting the blood flowing properly so there's no stagnation, so that there's no extra weight. If there's extra weight, that takes a life of its own and becomes inflammation. Whenever we have excess weight on us, it secretes what we call cytokines, which are a lot of pro-inflammatory agents. We want to get rid of that. We want to have anti-inflammatory agents. So movement actually helps. Movement helps. All right. Another thing that is so important to keep cancer at bay is sleep. I know. A lot of people are going to go, oh no, not sleep again. Yeah, sleep is so important. We need to sleep. We need to rest, because when we sleep, two main things occur. We cleanse, and we consolidate. So when we cleanse out all the harmful things in our body, because again, we live in this world, the environment, what we're breathing in and all those things, it is when we sleep that our body gets to do the work of clean out. So certainly sleep is so important if you have a family history of, or for every one of us actually, but more so if there's a family history of prostate cancer and you're undergoing treatment at the moment, or there's concerns, you want to make sure that you're optimizing your sleep. What is good number? Anywhere from 7 to 8 hours of restorative sleep. So sleep. Stress management is also one of those things. And these measures that I'm speaking about affects it. It helps with all form of cancer. It helps to decrease the incidence of cancer. So certainly stress management is a key. Is key to optimal well-being and just preventing increased cortisol. So cortisol is our stress hormone, and if we have it over a long period of time, it can cause a lot of damage to our vessels. It can cause a lot of inflammation. So certainly we want to keep those cancer cells quiet and out of the way. All right. And then social connection matters a whole lot, right? So there's tons of studies, and you probably heard me say this before, that what increases our longevity, it's really social connections, is how we interact with one another. So those are the things that I want to emphasize about prostate cancer. So it begs the question again. The question is, if there's any male listening, maybe live or in the recording, please, if you have not checked your PSA, your prostate test, please have that checked. Talk to your healthcare provider, talk to your physician, and let them know that you're concerned and you want to check. Anyone in their 40s, certainly if there's a family history, you can have that conversation about how soon you need to get that done. All right. Now, other things, I'm going to shift gears, and as I believe it was February 4th that it was World Cancer Day. Other cancers that we need to be aware of certainly is colorectal cancer, and that the guidelines have changed for that when you're 45, which I believe might change soon again, where we all get a screening colonoscopy. So that is important. We all know about the mammograms, which we get. Guidelines have changed. That used to be, it was 40, then they changed to 50, but have that conversation with your healthcare provider to make sure that you're up to date on that. Okay. Other screenings that we need to be aware of: Pap smear. Pap smear for our women, you need to get that once you turn 21, and it's between every 3 to 5 years. So depending on where you are, if you're over 30, I believe the guidelines have changed for that, it's every 5 years. So you want to make sure that you're up to date with your screening for pap smears, mammograms, colonoscopies, all the things that can prevent, when you say you're screening, you're checking for signs of cancer. There's a screening that I haven't mentioned, which is lung cancer screening, and that's for people that smoke. Whether you've been smoking for 20 years or you've quit within 15 years, and you're within a certain age, so between 50 and 80, you want to get screened for lung cancer. So those are the basic screening tests that I want to go over. So let me talk about commonly asked questions. If there are some questions and you want to share those, I'm happy to go over those. Or maybe if you come back later, if you think of a question, feel free to put that in. I'll circle back and answer. So one question that I have that is commonly asked is, well, do I have to get a rectal exam for every annual physical? So it used to be standard where males will get a rectal exam, they get the finger and examine their prostate for general. But again, back to the guidelines in 2018, where they were finding that there was a lot of false positive, I would say what is recommended now is really to do a PSA first, because there's several things that it can increase your PSA, right? The PSA is the test that we check for prostate cancer. So you don't want anything to influence your PSA. You don't want anything to influence your PSA levels. So you want to do the blood test first, and then depending on, I mean, of course, if you have symptoms, then you can do the rectal exam. But if you do the blood, if there are no symptoms and you do the PSA and it is high, then you want to follow up with a prostate exam. Certainly, you want to do that. Other things that can increase a PSA, and that's a question that has been asked before, are certainly, if you there are some medications that have been known to increase a PSA, so be mindful of that. Certain procedures, right? Just sexual intercourse also can increase a PSA. In terms of BPH, and what BPH means, it's a benign prostate hypertrophy. So with age, the prostate is going to enlarge, right? So it's going to get bigger, and the bigger it is, it can secrete more PSA. So that's why you want to look at the trend over years, right? So a benign prostate hypertrophy can increase your PSA. And what would distinguish the difference certainly is doing the examination to see how it feels, if it is rough against the edges or if it is smooth. And another aspect is certainly the biopsy. All right, let me tell you the third question that is commonly asked, and then we will begin to round down on this topic. So another question that, I get asked quite a bit is, what are my risks of dying of a prostate cancer? And I think I already alluded to it when I was talking, that prostate cancer is a slow-growing cancer for the most part, right? Now, prostate cancer is found in a much younger person. We find that is usually more of the aggressive type, but we found that on autopsies of much, much older men, they actually had passed from other things like heart issues than the prostate. So it's slow growing. But having said that, though, it doesn't mean that you should not check. Know what your numbers are, right? We don't want to guess. We want to test. So I encourage, and I've changed my practice now, especially given the climax and what we're seeing, is year of age, we're going to do a PSA. We're going to check. We're going to see what's going on. We're going to ask those questions. We're going to make a comprehensive evaluation of where you stand and what your needs are. So I hope that has been helpful. I've given some commonly asked questions. If anything else comes up, please feel free to run those by me. But I want to thank you so much for just taking the time to listen in today. Your time is valuable, and in this World Cancer Awareness Month, we're referring to prostate cancer deaths on the rise. I want you to again ask yourself this question: are you up to date? If you're listening, have you checked? And if you have, kudos. Keep checking, right? Once a year at least. And if it is high, your doctor, your physician, have that conversation about how often to monitor it. Or if you know somebody in your life, tell them, ask them. I have two brothers. I reached out to them. I was like, have you checked? my brother-in-law, have you checked? Right? So let's be each other's keeper, right? So I thank you again. It's not just about being informed, but it's being inspired to implement with actionable steps so that you can live at your finest by being whole, vibrant, and healthy, because we all deserve it, certainly. So we welcome your questions in the future, and I want you to share this great network with others so that we can all get healthier together. So as I depart, I want to share this nugget of inspiration with you. Good health is not something we can buy. All right? It's not something we can buy. However, it can be an extremely valuable savings account. Yes. So whatever little investment you put in every day makes a difference. It's not for nothing. You sleep a little extra hour, you move and you walk, whatever it is, you eat an extra piece of fruit or have an extra serving of veggies. It's a savings account. It's a valuable savings account. And that quote is by Ann Wilson. So again, I look forward to being with you next month as we return for another episode on the holistic perspective. So enjoy, take care, enjoy the rest of the weekend, and stay blessed.